Mental Health in Children Under 10 Years Old in New York City, created by Team B. Instructor is Dr. Nina Bell. Mental health in New York City with the youth. New York City is making leaps and bounds when it comes to protecting children from abuse, even though they are faced with tough budget cuts. Secrecy surrounds child abuse investigations, and therefore it creates more mandated reports. When we think about child abuse, we think about neglect, but so many other types of abuse exist. Abuse is defined as any act or failure to act, performed intentionally or knowingly causing harm to a child. Abuse can consist of inappropriate use of physical restraint, isolation, medication, or other means of harm. Mental health is not a type of abuse that you would think about in children, but as we find through research prevalent to 9/11, recent studies revealed higher than expected rates of mental health issues. Child abuse as well as child maltreatment are factors that contribute to mental health illness in children as well as the child's environment. If all factors are present, the likelihood of the child to develop a mental illness is high. Children in foster care are especially vulnerable. Be exposed to trauma and falling into the system, which usually involves protected services. Approximately 800,000 children are reported to be in the foster care system nationwide. Children that grow up under these circumstances are at a greater risk of developing mental health issues. To address this issue, it is imperative that behavioral issues are adequately addressed in its early stages to avoid bigger and more devastating problems later in life. There is a substantial variation in results depending upon the methodological characteristics of studies. One study finds that 1/4 of youth experience a mental disorder in the last year, and 1/3 across their lifetimes. One of the most common among this age group is anxiety disorders, followed by behavior disorders, mood disorders, and substance use disorders. Mental health issues are now being identified in the child psychiatric epidemiology, including refinement of classification and assessment, inclusion of young children and epidemiological surveys, integration of child and adult psychiatric epidemiology, and evaluation of both mental and physical disorders in children. Child Protective Services of New York was established in 1973, which helps children who have suffered from abuse or maltreatment. As stated before, child abuse also includes mental health, which is a type of abuse that has been growing. With that said, this law that was established in New York, in which each county of New York is required to provide services to investigate child abuse and maltreatment of children. This is a free service to all children, parents, and family members that are involved in suspected abuse and maltreatment. A statewide central register, also known as the hotline, is a telephone service in which victims can call freely to report the suspected abuse or treatment. The information is then relayed to the local Child Protective Service for further investigation, monitors a prompt response, and then identifies if proper reports or abuse maltreatment have been reported of the suspected victim. The hotline is a service that is available 24 hours a day, 7 days a week. The Monroe County Office of Mental Health is a program that is committed to improving the health and quality of life of county residents that are affected by mental illness, developmental disabilities, alcohol, and other drugs. Each county of New York City provides services as well, but this division of services is funded by the government to allocate public mental hygiene funds in accordance with the New York State law. The program is a comprehensive plan for mental health, developmental disability, and alcohol substance abuse services. Funding is allocated by local agencies based on the community priorities, treatment outcomes, and program performance. It also ensures coordination of services across levels of care amongst the providers within the community. Community mental health services are aimed at offering individuals and families treatment and support services that will assist them, avoiding unnecessary hospitalization or out-of-home placement, making help and treatment more affordable. Take Care New York is a policy agenda to improve the health of all New Yorkers, enabling them to live a healthier and longer life. This was originally launched in 2004 with the 4-year plan, which has made many accomplishments throughout the 4-year duration. With new strategies and goals launched in 2012 in mind, Take Care New York targets and prioritizes 10 areas in order to improve the health status of all New Yorkers, advance health promoting policies and activities, and to create, sustain, and strengthen communicate collaborations. Take Care New York focuses on the mental health promotion and healthy children and youth. The program focuses on eliminating the barriers to treat individuals efficiently and effectively, which includes following up properly with the individuals, families, family engagement, and linkage to the community support. Research has shown that the most crucial growth period and development for children is during the first 0 to 5 years of a child. The environment that the child is raised in affects his or her social emotional development, and negative experiences can impair a child's mental health, cognitive, and behavioral development. Therefore, children who come from families of abuse and neglect ultimately lead to the development of mental health problems, as well as other behavioral issues. Studies further show that children in foster care programs are at a greater risk for developing emotional and behavioral problems because they have experienced maltreatment and neglect before being placed into the system. With that said, to address this issue, the Child Abuse and Prevention Treatment Act developed a federal policy in 2003 which required child welfare agencies nationwide to have provision in place to identify and refer young children to early intervention services. The CAPTA provides minimum standards for each state to incorporate in the statutory definitions of child abuse and neglect, and must mandate early intervention programs for children in child welfare that present developmental delays. It also provides federal funding to states in support of prevention, assessment, investigation, prosecution, and treatment activities, and provides grants to public agencies, as well as nonprofit organizations to help those who suffered from child abuse and neglect. That means that facilities nationwide have access to the federal funding as well as the federal policy implemented to help prevent the development of mental health issues, as well as treating those who present the symptoms. Currently, the City of New York offers many different programs that help children that have suffered from abuse or maltreatment. Programs such as the Child Protective Services and the Monroe County Office of Mental Health focuses on improving the health of New Yorkers, especially focusing on mental health, promoting the health of our youth and children. With the limited providers that focus on mental health issues in children, there has been a push to adopt electronic health records, implementing information systems for quality assurance, accountability, and data sharing across providers, agencies, and counties. In doing so, it will allow providers near or far to communicate or for patients to have access to care regardless of the limited facilities and providers that the state may or may not have. This system will allow for record sharing between facilities, while joint planning improves efficiency and quality of care. New York City also developed on-site school mental health programs, psychological counseling and therapy within schools. There's 70 schools serving across New York City, serving 50,000 children annually. New York State Office of Mental Health, the Department of Health and Mental Hygiene, and the Citizens Committee for Children at Mount Sinai School of Medicine have all worked together to provide an on-school mental health program. Engaging families and youth in their own treatment planning and decisions is also being pushed to detect and treat early signs of mental health in children. Family support and family-based treatment are crucial to the children and youth resilience. Reaching out to the community stakeholders to increase their awareness and knowledge regarding mental health issues is especially for children from the foster care system. Children and families should be partners in formulating clinical service plans as well as clinical policies and services that impact their lives. A well-functioning system of care is needed for youth involved with numerous agencies and providers to achieve optimal outcomes. These values and approaches to a system of care are expressed in the Child and Adolescent Service Program and have been expanded in the New York State Children's Plan, which reflects the goals of providing coordinated, collaborative services to youth and their families or caregivers. Important stakeholders such as the Federal Maternal and Child Health Bureau of the Health Resources and Services Administration's General's Office are on board with promoting concepts of family-centered, comprehensive, community-based, culturally competent systems of care, and a number of technical assistance, training, research, and policy centers are all supported by federal agencies. Therefore, within the city itself and federal assisted, stakeholders at all levels need to address adverse youth health outcomes through effective partnerships that requires committed actions at state and community levels. To ensure that all children have access to the quality mental health services, New York City has advocated New York State's Medicaid redesign. This development of behavioral health organization streamlines mental health services to meet the unique mental health needs of children. This organization also advocates the expansion of school-based health and mental health services, as well as promoting early awareness services for children ages 0 to 3 that present developmental delays. New York City is also increasing the number of slots for children in treatment facilities, which eliminates the waiting list, providing better quality of service to meet the needs of children. Further efforts are being implemented to ensure the quality of services to children by providing training and education courses for the community, enabling the community to become children mental health advocates through programs such as Youth Action New York City and Community Leadership Course will help stimulate families and societies to practice and prevent the severity of mental health disorders. To enforce laws and regulations to help protect the health and ensure the safety of children with mental health issues, New York City's legislative information and the Bill of Rights enforces the ability to seek and obtain mental health treatment. Under the bill number A146, this law ensures that New York City schools receive financial allocations from the government for additional funding and support. Except where otherwise authorized by law, the cost of providing health, dental, or mental health services shall not be charged upon the school district or Board of Cooperative Educational Services and shall be paid from the federal, state, or other local funds available for such purposes. The approximated allowance given for such service is up to $6,375 and can fluctuate monthly depending on the state index. Bill number A00274 notes that 50% compensation towards the New York City Department of Health and Mental Hygiene from the Department of Agriculture. If refines are imposed on food retail and frames markets due to non-compliance of regulations, 50% of the payments are deposited in the general fund of the city. Bill number A00978 was amended in 2013. This law concerning mental health coverage for health insurance stakeholders is the bill states coverage at a minimal has to provide no less than 20 visits in a calendar year. Mental health practitioners include psychologists, physiologists, mental health analysts, and all other providers that are needed for mental health illness. Throughout New York City, there are many ways to access help for children with mental health illnesses. Community services as well as government-funded services are provided to those children in need. New York City Mental Health Program is accessible to children, adolescent, and young adults through school-based programs in which 330 schools around the 5 major boroughs of New York City services. Accessing additional services would require referrals to certain facilities. These referrals are made only after other appropriate community-based programs have been considered and rolled out. Early and effective mental health treatment can prevent a significant proportion of delinquent and violent youth from future violence and crime. It also enables children and adolescents to succeed in school, to develop socially, and to fully experience the developmental opportunities of childhood.